morning friends, I am Dr Rajat and with me Dr Sapna. We both are gynecologists from Matrut Hospital, Vadodara. Welcome to our YouTube channel Gynac Didi and Gynac Mala. Today the topic we have selected for our discussion is ovarian cyst. Many of the patients in our OPD come and talk and they have many confusions in their mind regarding the ovarian cyst. What is an ovarian cyst?
Yes.
So how common are the ovarian cysts in your practice? So what are the causes of ovarian cyst? What are the different types of ovarian cysts we normally encounter in our clinical practice? Do all the patients of ovarian cysts have symptoms? All. So first of all, Sapna, how are you?
I'm very good.
Okay. For the benefit of our viewers, explain to them in a layman language what is an ovarian cyst.
Yes. So you are talking about this ovarian cyst. So these are actually in English, if we understand, these are fluid-filled cavities which we can see in ovaries. But before that, I would like to explain the structure of uterus. Can you just pass it? Thank you. So first of all, we would like to understand that this is the structure of a uterus. We have a uterus, the mouth of the uterus called as cervix, the two fallopian tubes and the ovaries, the left ovary and the right ovary. So these are ovaries. So any cyst or any fluid-filled cavity in the ovary is called as ovarian cyst. And in Hindi, if we understand, the pani ki gaant.
Now, why I am not talking about the word gant, because the moment we say word gant, the people try and understand that it is a cancerous sort of a tumor. That is why it is better to talk it in medical terms, which is called as an ovarian cyst. Now, why we have selected this topic today is because the moment a radiologist or a sonographer writes on a report cyst, and most of the people start thinking and overthinking, and they go on Google and go to Dr. Google and research about ovarian cyst, and they come to us with lots and lots of questions. So today we will be discussing about all those questions and we'll try and denigrate those myths and facts along with some medical explanations. So how common are the ovarian cysts in your practice?
Statistically, if you go by books, it is like 5 to 10% they are common. But as practically as a clinician, what I would like to say that it's very common. Like mostly either we are incidentally diagnosing when we are doing sonography for some other purpose, or people are coming, the patients are coming with the reports. Oh doctor, I have got a cyst in my report, and what is it? Is it cancerous? And what to do about it?
So if I summarize the ovarian cyst, most of the females at some point of their life, they have got an ovarian cyst which they may or may not know, and most of them are harmless. Am I right?
Yes, most of the time they are harmless. Again, when the patient walks in, we always look at the wholesome picture. We don't go by reports. We have to see what is the age of the person, whether she is a young girl, she is in reproductive age, she is trying for infertility, she is a PCOS or some hormonal problem patient, she is nearing menopause or she is post-menopause.
Okay.
So all these things we have to take into account.
So what are the causes of ovarian cyst? What are the different types of ovarian cysts we normally encounter in our clinical practice?
The most common is like follicular cyst or hormonal cyst that we routinely see in our practice. And other types are like corpus luteum cyst, hemorrhagic cyst, sometimes they are simple ovarian cyst, or most common, the very common name which we usually people know is chocolate cyst. That is endometriosis.
See, what happens is any female who has got a regular menstrual cycle, whenever there is a growth of a follicle which normally happens, the moment that follicle grows and at about between 16 to 28 millimeter the follicle ruptures. Sometimes the follicle rupture does not occur and the follicle becomes more in size, and the moment it grows more than 30 millimeter, we in our medical jargon call it as an ovarian cyst, and those are the most common cysts which Sapna was referring to as follicular cyst. After ovulation, the follicle becomes an entity called as corpus luteum, and sometimes that corpus luteum does not also rupture, it does not become a small in size, does not regress, and it becomes a corpus luteal cyst. So these are the two most common hormonal cysts which we encounter in our clinical practice. So do all the patients of ovarian cysts have symptoms? All they have complaints, some kind of things?
Not all patients have symptoms because it depends on the size of the cyst. Only if the cyst is very large, like something like more than 5 cm, between 5 to 10 cm, they will have mostly present with the symptoms. And anything like less than 3 cm, 3 to 5 cm, mostly they are harmless and symptomless.
The symptoms in the cysts which are larger than 10 cm are mostly because of the pressure symptoms. If the cyst is compressing the urinary bladder, it may lead to a difficulty in urine. If it compresses the rectum posteriorly, then it may have difficulty in passing of stool, or it may, if it compresses the intestine, then it may have some digestive difficulties.
Right.
So,
and the question which you asked me, are they harmless? Basically, mostly females, they come with the problem, complain of irregular menstruation or they have missed their periods and they are worried ki, have I conceived or why my periods are missed, and that time when we scan them and we do a sonography, that time we are mostly diagnosing that they are having some simple follicular cysts.
Now the most common complaint which with the patients call me and they ring me, would the ovarian cyst have pain or if they are having pain, will I have a ovarian cyst?
It is not like that. All simple ovarian cyst does not have pain,
Okay.
right? Only the cyst like chocolate cyst or hemorrhagic cyst, they are mostly present with pain. And again, the size is very important. Like 3 centimeter or 4 centimeters, sometimes they are totally painless, no symptoms. Like, but anything more than 5 centimeter will present with symptoms like pressure symptoms and the menstrual disturbances.
Okay. So a radiologist has diagnosed a ovarian cyst in a patient and she has given you a call. The patient is
Right.
horrified, worried, tense. What would you do next?
Patient has given me calls.
Yeah.
I would call her personally in my cabin. I will see the report in front of her. I have my own sonography machine, so I would like to do a scan by myself and will show her and explain herself and the relatives that what type of cyst. And as we are talking about right now only simple cyst and follicular cyst, I will look her in a wholesome way. What is her age? As I earlier said, that if she's a young girl like less than 20 years, so these are very common because her hypothalamo-pituitary axis, the hormonal axis is maturing. So this is a very common thing which we see, common reports which we see in our OPD. But any female who is like between 20 to 30 years, she is trying for pregnancy, then we have to ask her whether she is taking any treatment for pregnancy or whether she is taking any ovulation induction drugs, or whether she is a PCO patient, like she has symptoms and features of polycystic ovarian disease, because in this hormonal problem, polycystic ovarian disease problem, the cysts are very common. And if she is more than 30 years, then we have to keep in mind of other like precancerous and benign lesions as well.
Like she said, age is very important. A 4 centimeter cyst in a 30 to 40 year female is probably not going to be worrisome, but the same cyst in a female more than 55 year or who is postmenopausal is going to be a worrisome thing. So we have to correlate with the age. And second thing which she meant when she'll examine her and give a good history taking, she has to correlate the size of the cyst along with her LMP, last menstrual
Correct.
period. The correlation along with the menstrual cycle is very, very important because most of the times those are physiological and we do not need to do anything. So Sapna, how will you manage a case of a ovarian cyst? I mean, the patient has come to you, you have diagnosed the ovarian cyst, say 5 by 5 centimeter ovarian cyst in a case of a 25-year-old female. How do
Right.
you manage?
Case of 25 years, so here the female is like more than 20 years and her hormonal axis has totally matured, and now we have found one cyst for her. So first I would ask what is her complaints, whether she is having menstrual disturbances, any pain in the abdomen, or any other pressure symptoms like urinary or defecation difficulties are there. So all these things I will ask her.
She doesn't have.
She doesn't have. So what I will give, I will counsel her that this cyst by sonographic appearance looks like, because in sonography we can see, because simple cyst, whether the cyst is cancerous or non-cancerous, we can very well find out with the help of our sonography. We have strict criteria and classifications. We also correlate with our history and the presentation of the patient. So now I would like to counsel her that it looks like a simple cyst and it looks like a hormonal disturbance in your body, and I will prescribe her hormonal pills for 2 to 3 cycles, and every month I can follow her up with the sonography and look for the size of the cyst, whether cyst is decreasing or whether cyst has dissolved. So we have to go with watchful expectancy, with basic counseling that this is totally normal, little bit counseling about day-to-day work, like don't do heavy work or heavy exercises because there is a cyst sitting in your abdomen, and then every 2 to 3 months we have to follow her that whether it is getting dissolved or not.
Okay, so are there any blood tests which we do for those ovarian cysts?
Yes, as you have already mentioned that any cyst which is happening in the elder age group, like more than 30 years, the size is more like more than 5 centimeter, we have to always keep in mind the precancerous conditions of the benign cyst. So we cannot leave them as such. We can go for a watchful expectancy, but at the same time we would like to do some tumor marker tests. So these are like simple blood tests. There are 4 to 5 varieties of them, and we check it with the help of a simple blood test.
Could you enumerate the tumor
Yes,
markers?
like CA125, tumor, this like LDH, then we have alpha fetoprotein, beta SCG.
Now the basic advantage of getting these tumor markers is it will mostly rule out the malignancy. If they are positive, then the chances of tumor the cysts being a cancerous are more, and if they are normal, then it gives a reassurance to the patient that my cyst is mostly non-cancerous, and then which we can help us in watchful expectancy. And if by watchful expectancy the cyst does not resolve by itself within 1 or 2 months, then maybe we can go for a hormonal pills. So what are the dangers of ovarian cyst? Why the people are so worried, or in other words, some people they try and scare the patients of the dangers. What are the so-called dangers?
Because what is happening is any cyst which is more than 5 centimeter, what we are worried is we are worried about ovarian torsion. So what happens if the cyst is like a ball? You can understand a small ball. I am talking about big cysts like more than 5 centimeters, 7 or 8 centimeters. They can rotate and twist on its own axis. So once they rotate or twist on its axis, what will happen? The blood supply will get totally obliterated and the cyst will become necrosed. And there will be sudden pain in the abdomen, and this will be like a total emergency, and we need an emergency surgery for the same.
And that condition is called as an ovarian torsion.
Right.
So what are the symptoms of an acute ovarian torsion, or when do we suspect or when do we diagnose clinically a case of an ovarian torsion?
Yes. The patient normally presents with lower abdominal pain, which is quite severe. It is persistent, not getting resolved with the help of painkillers or injections. Then sometimes associated with vomiting, giddiness, and all these features are there. And then patient presents to us, and then we elaborate the menstrual history. We do a scan and we see there is a cyst sitting, and that cyst is quite large.
So what are the best investigation modality for diagnosis of an
first
ovarian
diagnosis
torsion?
we have got that all these symptoms are because of the cyst, and your cyst is more than 5 centimeter, and it is creating lot of symptoms to you, and especially the dangerous symptoms are there. So immediately we would like to send the patient to an expert radiologist to rule out the ovarian torsion, because in sonography with the Doppler studies we can immediately diagnose whether torsion is there. If there is a torsion, then it becomes an emergency. But if there is no torsion, then with the watchful expectancy, symptomatic treatment and hormonal treatment we can give to the patient.
What she means by an emergency is that in a ovarian torsion case, a patient has to be operated immediately upon, either laparoscopically or by an open laparotomy. And then we have to see whether the ovarian tissue is still intact or not, or it is live or not, or it has necrose or not. The moment it has necrose, we need to remove the ovarian tissue. If it is not necrose and it is still live, we can do a detorsion followed by an ovariopexy. That is a video for another discussion. So the crux of the matter is ovarian torsion has to be operated immediately.
Because we want to save the ovary.
Save the ovary. Now there are frequently asked questions. I'll put in the long questions, you'll have to give me the short answers.
Right.
Are the ovarian cysts only seen in the women of old age?
They are very common in older age, but they are seen in all age groups.
Okay. Are all the ovarian cysts same?
No, they are different. Like follicular cyst, corpus luteal cyst, hemorrhagic cyst, chocolate cyst.
Why it is called as chocolate cyst?
Yeah, chocolate cyst is very commonly, even common men know, because these cysts are like brown appearance, and when you open them, there is a brown color liquid which we can see inside it. Basically, this is a collection of blood which is there for a long time. So it is called as a chocolate cyst. And in sonography also, they have a very typical ground glass appearance.
Okay. Are all the ovarian cysts a sign of an ovarian cancer?
No, not at all. As we are already discussing that most of the time they are hormonal follicular cysts.
Do all the ovarian cysts cause abdominal pain?
No. Anything like more than 5 or 6 centimeter, if they are big, then mostly they present with symptoms. But like 3 centimeter or 4 centimeter, sometimes they don't present with anything.
Do we need to do CA-125 in all the cases of ovarian
Not
cysts?
all cases. Younger females, mostly we go with watchful expectancy. Only if they don't dissolve in 2 to 3 months, then we have to think about tumor markers.
Do we require surgery in all the cases of ovarian
Not
cysts?
at all, not at all. Young female, 3 or 4 centimeter size cyst, always we can go for a watchful expectancy of 3 to 6 months. In between we can also add on tumor marker test to rule out benign conditions. We can go step by step.
Does ovarian cancer have any specific symptoms?
Early ovarian cancer. So, if anybody would like to have ovarian malignancy, it is the worst malignancy because it mostly doesn't present with symptoms.
I had studied in GCRI, Ahmedabad Cancer Hospital, Ahmedabad, and my teacher used to say early ovarian cancers are drowned in the sea of antacids. That means most of the patients have got symptoms suggestive of upper GI acidity and all those kind of things, and most of them pop an antacid or acidity pill. So everybody who is having acidity, please get an ultrasound done once and just consult your gynecologist once, just to rule out.
Here I would like to add on something. When the females are between 20 and 35 years of age, because they are like reproductive age group, so when their pregnancies are going, somehow they are getting themselves scanned. But once their family is complete, they are not at all visiting gynecologists, not even for pap smear test or breast checkups. They are not at all visiting them. So every 1 year they should have a little bit of their checkup by a gynecologist.
Actually, in India, the concept of a preventive health checkup is not there.
Right.
By preventive health checkup means everybody should visit a doctor once, and this is not for business. I know I will be getting lots of trolls and comments on this, but this is not for business. Please visit a doctor once, just get your basic blood test once. Even for males, even for females, in females especially, get your breast checked, get a basic pap test done, get a basic ultrasound done, just once in a year, hardly
So
takes.
this is highlighting. We just said that early ovarian cancer does not have symptoms.
Any symptoms.
But if you go for preventive health checkups and some cyst or some solid mass is lying there in your abdomen, you can pick it up early. And if picked up early, there is treatment available.
There is treatment early. So how do you deal with the ovarian cyst which is there in the pregnancy?
Again, same thing, we have to again see if there is an incidental cyst present with pregnancy. We have to look at the size, something like 3 to 4 centimeter, not creating any problem. We can just leave that with watchfulness. Every time we can monitor whenever she is getting scanned. And if it is big in size, and if at all we have to operate, we mostly prefer to remove it in second trimester, somewhere between 4th, 5th and 6th month. They are very safe to remove by laparoscopically.
So what are the symptoms of a ruptured ovarian cyst?
Again, any rupture means severe abdominal pain, again sudden syncope, giddiness, maybe vomiting.
But that pain is for only 1 to 2 hours, then it subsides after that, when it is usually relieved by analgesics, and they know, most of them usually don't need much of an active management or a surgery. So can ovarian cysts be prevented or avoided by any means?
Ovarian cysts are very common because they are hormonal disturbance. But again, I will come to the same question. Hormonal disturbances are because of obesity, the lifestyle changes we have to do, our bad diet. So if again there comes the same thing, that we have to have regular exercises, we have to have a good fiber and good diet for our hormones. So if hormones are in good harmony, ovarian cyst can be prevented, and for that we have to work hard every day.
So if a patient is presenting with a 4.5 centimeter ovarian cyst, is it a large ovarian cyst, or in other words, what is a large ovarian cyst?
Anything more than 5 centimeter and anything which presents with the symptom. And again, what is the age group? More than 30 or 35 years, we have to appropriately do the workup.
At what size would you consider a surgical removal of an ovarian cyst?
Nearing 10 centimeter. More than 10 centimeter or nearing 10 centimeter, it is huge, it can undergo torsion, and the age group is very important.
Or any cyst between 5 to 10 centimeter, if it is not getting resolved by a medical management in 3 to
Yes.
6 months, and it is not getting resolved. So what are the possible complications of ovarian cyst?
The main complication we have already discussed, that we are very much worried about the ovarian torsion, the twisting of the cyst on its own axis. And again, if the cyst is presenting there, sometimes what happens, if the female is trying for conception, she may not be able to conceive, and there are hormonal cycles, that cycles are disturbed totally.
So for our viewers, there are various myths and facts. I'll just enumerate. The cysts in the ovaries are cancerous and they cause various health problems. Is it true or false?
Not all cysts are cancerous. We have to look it thoroughly, how is the presentation.
Ovarian cysts almost always cause abdominal pain and menstrual irregularities or painful cycles. True or
No,
false?
this is false.
Okay. Do all ovarian cysts cause infertility?
No, not. But sometimes if patient is not conceiving, then we have to treat it.
Do all ovarian cysts require surgery?
No.
Okay. Recurrent cysts can be prevented.
It cannot be prevented, but as I said, that we have to have a good lifestyle and hormonal issues we have to control.
OC pills are useful in ovarian cyst.
Yes, they are very useful. They are very commonly prescribed. They are called as hormonal pills, oral contraceptive pills, and they are very, very safe. And 3 to 6 cycles of OC pills. In my practice, what I see is mostly within 3 months, 90 to 95% gets dissolved.
So PCOS does cause ovarian cyst?
Yes, PCOS is a very common problem which presents with ovarian cyst on and off.
A cyst is always a cause of concern for a female.
For a female, it is a cause of concern, but as a clinician, we have to counsel them. We have to tell them what is normal, what is abnormal, how to watch it, how to monitor it. We have to tell, and if she is planning for pregnancy, we have to advise her wholesomely.
So this was our short and brief discussion about ovarian cyst. Let me send some carry home messages. Cyst is not always a cause of concern. Most of them are harmless. Many a time they go away on their own, and we do not have to do anything. Just watchful expectancy. And if they want to do some medications, OC pills or the hormonal contraceptive pills, they are the best medicines, and most of them they do not end up in ovarian cancer. Still, caution and precaution is the need of the day. Thank you. Bye bye.
Bye bye.